I'm now going to introduce Sarah, and Sarah will be talking about the pancreas and what happens when bad things happen to it. And Sarah is getting ready to pull up her presentation here in a minute and share it with us. We hope.
Yes.
If anybody in here does not have their presentation and they wish it, if you can, type your email in chat and I will snag it and send you the presentation, or you can just send me an email. And now I'm going to turn it over to Sarah to talk about pancreatitis.
All right, can y'all see the PowerPoint?
Yes, ma'am.
Okay, sounds good. So good morning, everybody. My name is Sarah, and today we're going to be talking about pancreatitis. And this is both acute pancreatitis as well as chronic pancreatitis. So by the end of this presentation, you should be able to identify the signs and symptoms of both acute and chronic pancreatitis, explain the differences in treatment for acute and chronic pancreatitis, and apply lifestyle recommendations for acute and chronic pancreatitis. So first of all, what is the pancreas? The pancreas is both an organ and a gland, and its function is to help with digestion. And so as you can see, it's located right below the stomach. And it empties into the small intestine. And so again, it helps with digestion. It releases enzymes that help break down proteins, carbs, and fats. And this is how our small intestines and our large intestines absorb these products as it gets broken down. And the pancreas also produces hormone called insulin, which also helps regulate our blood sugar. So as you can see, the pancreas is an essential organ. You can live without your pancreas. However, it does require chronic medications. So this includes enzyme replacement, which we'll talk about a little bit further as we get more into the chronic pancreatitis, as well as insulin. So because if you have chronic pancreatitis, you're not producing the insulin your body needs, and so that's when you're going to be starting on insulin. And just to go back, just a little bit background about the statistics of pancreatitis. So for acute pancreatitis that occurs, there's about 275,000 hospital stays a year. And chronic pancreatitis doesn't occur as often. It's about 86,000 hospital stays a year. And then as far as a high-risk patient population, so this includes men, African-American race, and particularly if a patient has a family history of either pancreatitis or gallstones. So what is pancreatitis? So oftentimes with the ending of this word, titus, sometimes people think it's an infection, like from a virus or a bacteria. So pancreatitis actually occurs when the enzymes it produces start to damage the organ. And this causes inflammation, just a general redness and swelling of the pancreas. And pancreatitis can be either acute again or chronic. So acute is when you're going to have the severe pain in the upper abdomen or stomach area. While chronic pancreatitis is a more permanent damage of the pancreas and your pancreas just stops working. So as you can see in this picture here, on the left, we have a healthy pancreas and it looks, perfect and colored and all. And then on the right, we have the inflammation starting. So again, it's just like a redness and a swelling of the pancreas. So first off, we are going to talk about acute pancreatitis. So the first main cause of acute pancreatitis is going to be gallstones. So gallstones can cause inflammation in your pancreas as the stones pass through and get stuck in the pancreatic duct. And so this condition is called gallstone pancreatitis. So otherwise, we can see that acute pancreatitis can be caused from excessive alcohol use, high triglycerides, smoking. If you have a biopsy of the pancreas, particularly of the bile duct, that can cause inflammation of the bile duct and lead to acute pancreatitis, high calcium levels, and medications. So of course, from our perspective, including Dr. Baldwin and me and my classmates as future pharmacists, we're always thinking about medications. So some medications that can cause pancreatitis includes diuretics or water pills. So this is furosemide or Lasix or hydrochlorothiazide is also another diuretic. Azathioprine, which is if you have like an organ transplant, and this medication kind of just decreases your immune system, so you don't reject that transplant. Birth control pills, estrogen, a few antibiotics. So this includes doxycycline, minocycline, or tetracycline, and these all belong to one class. Steroids, such as corticosteroids, again, this is they act to decrease the body's immune system. And drugs that have sulfa in it, so particularly sulfasalazine and sulfamethoxazole, which is another antibiotic. So how is pancreatitis diagnosed? So first, signs and symptoms, it's going to be severe pain in, again, the stomach region. You can have nausea and vomiting, low blood pressure, fast heart rate, and you can also have a low-grade fever. So your signs and symptoms, along with a few additional diagnosis criteria, is how pancreatitis is diagnosed in general. So when you go to the hospital for your severe pain, the doctor is going to look at your enzyme levels and as well as an ultrasound of the pancreas. So all these things kind of play into how pancreatitis is diagnosed. So approach to treatment. So this slide is very general, but you will see on your handout each section, and we'll go in to talk about that a little bit. So supportive care is the first step to treatment of pancreatitis, particularly acute pancreatitis. And this occurs, so again, you're going to have this severe pain. The patient's going to go to the hospital. So this is being treated in the hospital. In supportive care, it's really important to start treatment within 12 to 24 hours of the first signs and symptoms. So this includes given fluids, IV fluids. This is either lactated ringers or normal saline, as well as electrolytes. So magnesium, calcium, potassium, and glucose are all going to be needed. Number two, nutritional support. So again, because your pancreas isn't producing the enzymes that your body needs, you're gonna wanna get those from your diet. And the diet really depends upon the severity of your symptoms. So if you have mild nausea and vomiting, we're gonna wait until that clears up, and then you can resume a normal diet. However, if it's really severe nausea and vomiting, that's when you're going to want to have a feeding tube, and this is either placed in the stomach or in the intestines. As far as pain management, again, this is really something really painful. So we're going to start with IV pain medicine, and this is used through a patient-controlled pump. So you just press the little button and you get that pain medicine. And from there, we can transition into just a regular oral opioid, and then kind of go down from there. as well, because these pain medicines are opioids, we're going to do a bowel regimen just so because opioids can cause some constipation. So a bowel regimen just helps you stay regular. As far as nausea management, so this includes anything like Zofran, Phenergan, and Compazine. So again, not only do we want to make sure you're eating correctly and getting that nutrients you need, but also managing the nausea and vomiting, diarrhea. And so antibiotics. So again, with pancreatitis, this isn't something that is caused necessarily by like either a virus or bacteria. So antibiotics aren't actually needed often. The only time antibiotics are needed for pancreatitis is if it's the pancreas is damaged, otherwise known as necrosis, from bacteria. And this is typically, so you're going to be in the hospital, and this typically occurs if you're not improving within 7 to 10 days. So that's when the doctors will consider starting antibiotics to help with the bacteria. And of course, specifically with chronic, which we'll get into, but surgery could be another option for pancreatitis. And so your doctor may recommend surgery to remove either the gallbladder, again, because that is the first thing that we think about with pancreatitis, if gallstones have been causing the pancreatitis. And then having surgery occurs typically within a few days, and it does lower the rate of complications. So we'll go into the complications of pancreatitis. So some of the complications of pancreatitis include kidney failure, again, infections, such as the necrotizing pancreatitis, which needs antibiotic treatment. A pseudocyst. So a pseudocyst is in the pancreas, and it's just like a fluid-filled sac. Again, this can lead to further infections. Malnutrition, as we talked about, you're not absorbing, you're not digesting and absorbing the nutrients that you need because you don't have those enzymes. Diabetes, again, because the pancreas helps produce insulin in the body. So if it's not working correctly, you're not going to have the insulin you need. So the sugar just hangs out in your blood and it causes diabetes, which can lead to other complications, as well as pancreatic cancer. So pancreatic cancer is more likely, again, if someone has diabetes as well as pancreatitis. So it's really important that even acute pancreatitis is treated quickly with the appropriate management. So now we'll go into chronic pancreatitis. So some causes of chronic pancreatitis, the main one is alcohol. So this is like a lot of alcohol over a long period of time. Smoking, as well as unknown causes. And this can also, acute pancreatitis can also be caused by unknown cause, which is idiopathic pancreatitis. So some signs and symptoms of chronic pancreatitis. So similar to acute pancreatitis, we're still going to see the abdominal pain. So the severe abdominal pain, as well as weight loss and floating stool. So if you think about it, chronic pancreatitis is when your pancreas is like not working at all. So the weight loss, because you're not getting the nutrients your body needs, and basically you're passing all of the nutrients into your stool. So this is kind of where floating stool comes from, because the nutrients includes fats. So if you're not absorbing the fat, it's just going to go right through, and when you go to the bathroom, you're going to see that your stool is floating because it contains a lot of fats and lipids. So approach to treatment. So similar to acute pancreatitis, chronic pancreatitis, we are going to focus on pain management. However, this is a lot to do with lifestyle lifestyle changes. So we definitely, stop alcohol use because that is one of the main components. Stop smoking. Diet restriction for fat. So it's recommended to have no more than 20 grams a day of fats. So when thinking about foods that have fat, you want to look for like low fat or fat-free yogurt or any kind of dairy, including milk. You can choose light cream cheese over regular cream cheese or fat-free cream cheese. As far as other foods, low in fat, this includes egg whites or egg substitutes. As far as meats, chicken or turkey breast, and grains like hot oatmeal or grits, and then rice or noodles, that can be low fat as well as brown rice. So just some things. So it's really important to watch the diet and the fat restrictions. And as well as diet, so same with acute pancreatitis, we want to eat small meals more frequently. So traditionally, I would say the normal American eats 3 main meals with snacks. So instead of that, we want to break that down into about 6 meals a day and just smaller portions so you're able to digest everything that your body needs. And then pain medicine. So unlike acute pancreatitis, where we start out with IV pain meds, this is more like a stepwise approach. So for pain meds for chronic pancreatitis, we're going to start out with NSAIDs, as Hannah had mentioned earlier. They're over-the-counter pain medicine. And then we kind of do a step up from there. So we can do tramadol, and then go into like the opioids, which is a last line. So you want to start with over the counter NSAIDs first and then step up from there. And then again, if after this, if the pain is not managed, you can be looking at surgery. Either removing just a part of the pancreas or the whole pancreas. As far as digestion management, as mentioned earlier, so the patient would need pancreatic enzyme supplement. So this, in your handout, there are examples of what these are. And so this would be taken with meals or snacks, again, just to make sure that your body has all the enzyme it needs to digest the foods that we're eating. So, we don't have the weight loss and the stool with a whole bunch of fat in it. And then diabetes management. So this is going to start, again, because your pancreas is not producing the insulin to remove the sugar from your blood. Diabetes management is a definite must. So this is going to start with metformin, which is an oral diabetes medication. And then from there, you'll be looking at insulin. So here are my references. And what questions can I answer at this time?
Okay. Hearing none, and let me check chat. I see none.
I have a quick question.
Never mind. They would just took some time to unmute herself. It is all you, Judy.
If, you said one of the causes of pancreatitis could be gallstones. When someone has their gallbladder removed, are they still at risk? Or because the gallstones and the threat of gallstones are removed with the gallbladder gone, does that reduce that risk factor?
That's a great question. I don't know definitively, but just the way you were explaining it, it does make sense that if the gallbladder was removed, that risk factor would go away because your body's not producing, wouldn't have the chance to produce gallstones. So I think if you do have your gallbladder removed, then you're looking at, the other causes of pancreatitis like alcohol use, high triglycerides, smoking, things like that, or even medications.
I think she's correct, Judy, but I'm not 100% sure. We can look into it and get back with you if you wish.
We don't, and I guess what crossed my mind was, did they have a series of gallstone attacks before they had it removed? How much damage was done? I mean, and so I guess it just makes me kind of wonder, is someone still at risk, and are there mitigating factors as to the level of that risk still?
Yeah, I can definitely look into that and get back with you.
Thank you.
Okay, does anybody else have any other questions for Sarah? Okay, this time, hearing none, I will go ahead and stop the recording.